Project Vector's been pulling data from multiple media sources since October 2019. So we have a few months of data now. It's funded by the New York State Health Foundation. And it tracks not every reference to vaccines in public media data, but it's specifically focused on references to vaccine opposition. My bias as an individual and the bias of PGP, my organization, is public health. That's the lens that we see this through. So I'm a public health practitioner myself. And I am concerned about the rising vaccine hesitancy and sort of mistrust in science and public health. So that's my perspective on it. And that's why we built the tool and we provide this data to health reporters and public health organizations, because I don't think we can address legitimate concerns and illegitimate concerns unless we know what people are talking about, unless we know what those concerns are. And we understand the talking points and we understand where it's coming from. And this is new to public health. We're still trying to adapt to this fragmented media landscape that we all exist in these days. But if you go to Project Vector and you sign up, typically we'll preview very quickly. This is what you would be presented with when you first showed up. So there's usually a little overview video of the data that we've presented from the month prior. And this is kind of where the human curation comes in. If you can see here, what we're doing, this is updated every week, is we'll tell you typically it's 3 stories. So it's 3 pieces of information, often misinformation or disinformation, that's being spread through social networks by individuals who are, for their own reasons, opposed to vaccines. And so again, this is supposed to be a means for us all to be more aware of what the talking points are. And if there is information in there that is not factual or not grounded in the evidence, it's designed to be a way for public health to address that, to respond. So you can see here are 3 stories this last week that were very popular and circulating around on Facebook pages and Twitter accounts and other places where vaccine hesitancy and vaccine opposition often is placed and percolates, and then eventually spreads through all online media. I won't go into these, but this is just meant to be a capability discussion. What we've also done is, because this project started in New York, we do the same thing for upstate New York and then New York City. Over the next coming weeks, in fact, launching just next week, this will be a more robust tool, and we're adding in a dashboard that's specific for every single state in the United States, so that you can see, is there a difference between where I live and where what's spreading around nationally. And I can tell you that we're also planning on making an interactive dashboard for health reporters, for health journalists as well, because I realize there's a different use case for a public health practitioner and a journalist. To show you a bit more, there's a data tab here. So this will show you over the last week, here are how many individual references to vaccine opposition we tracked, where it came from, so the different types of media sources, media breakdown. And then this is kind of where the curation comes from. We go in, there is a lot of machine learning and natural language processing that's part of this. There are enormous amounts of data, but we'll go in and we'll try and help you, if you have just a few seconds, understand what are the talking points about, what are they referencing, and then are they talking about particular health conditions? And you can see here we've divided up by health conditions. And then we go themes. So talking points shift all the time. And so every week there are changes. And you can see here we've listed a lot of the conditions that are talked about in a given moment, as well as a lot of the themes. Then if we go down, you can see this is focused on Twitter. But you can see that the top tweets around vaccine hesitancy and where they came from, these are links. So you can actually click here and that will open the original tweet. And so you'll get familiar with the individuals and the organizations and the accounts that are most responsible in a given moment for spreading messages that are opposed to vaccines. And we also have the websites as well. So some of these are blogs, some of these are forums, some of these are websites, but what we're trying to do here is to help individuals and organizations that are looking at this through the lens of public health understand what is vaccine opposition. I hear about it, who's doing it, who is that, what are they saying, so that we can wrap our heads around it. Here are Twitter authors. So those of you who have covered this topic before, a lot of these individuals will not be new to you, but some are. Some do actually change week by week. And you can see these are Twitter accounts that are most often mentioning vaccine hesitancy or vaccine opposition. These are the accounts that are most influential. So not all of these are vaccine opposers or anti-vaxxers. These could just be really popular accounts that are mentioning vaccine hesitancy. So for example, CBS News is covering vaccine hesitancy in this case. And then you have accounts by engagement. So Lotus Oak 2 is probably the most famous anti-vax Twitter account. And that account gets a lot of engagement every day, every week, very heavily followed, and is a really core figure in the leadership of the anti-vax movement. And then at the bottom here, we have automation. So like other tools that Sunny listed off earlier, these are pieces of information that either because of bot activity or because of some other form of automation are amplified across Twitter in particular, but also across blogs and websites. And we highlight this because we're trying to show if these are spreading further than human thumbs can do on their own, we feel like that's important to keep track of. Now, I'm going to jump real quickly. This would be what a more interactive dashboard looks like, and this is what's coming. Signal Labs is our data provider, so not involved in this project, but that's where the data comes from. I wanted to show this because these graphs here, what you're looking at is the difference between pre-pandemic and during the pandemic. And vaccine opposition has actually skyrocketed during the pandemic because of the pandemic. So both sides have become more entrenched. There are new players in the anti-vax movement. There are new talking points. All the old players, all the old leaders are still there. They're still involved, but they're adding new ones. So you can see here, again, these are just mentions of vaccine hesitancy or vaccine opposition, really. Before the pandemic started, we had about 5,400 a day. And now we have 14,400 a day. So just an enormous spike in opposition to vaccines. Here's a different representation of the same data. You can see here just an incredibly huge spike has occurred really since the pandemic started. A further entrenchment, a further doubling down on really a belief system. Here you have what a lot of these messages are about. So you have COVID-19 is obviously a really popular topic of conversation, but vaccine ingredients are still a big deal. There's a war on Bill Gates by anti-vaxxers. He's become enemy number one. So a lot of the conversation is against Bill Gates in particular. He's become the face of vaccines. Discussion about mandatory vaccination, a lot of vitriol thrown at Dr. Fauci, still another face. And then that recent documentary that came out called Plandemic, that spiked the conversation as well. And I think you can see here, if I remove some of these topics, you can kind of get a relative sense of the increase over time. But you can see it's right there in the data. You have pre-pandemic and then during, and there's a really big change. Word clouds here. Robert F. Kennedy Jr. is an enormously influential figure in the anti-vax movement. He is one of the de facto leaders, and he uses his social media accounts to daily attack vaccines, as well as individuals who promote them. You can see here, these are the trending stories. So Robert F. Kennedy Jr. comes up often, along with Andrew Wakefield, sort of the discredited British physician who wrote the original studies trying to link MMR vaccines to autism, which was debunked and his medical license was taken away. But he's living in the US now, and he's a really popular figure. And they're very large followings. And those followings are growing. Popular tweets in the moment, but I'm going to skip. So here's, again, just pre-pandemic on the left here and current situation here on the right. And I wanted to just give you some really quick data. Only about 50% of vaccine leadership carried over into the pandemic. So there's another 50% on top of that now that are new emerging leaders that have taken the crisis and are putting forward their own talking points, attacking vaccines. And if you look at those, who they are, about 30% of these new individuals are self-proclaimed doctors. And so we haven't verified whether they're actually doctors or not. They say that they're medical doctors. And a lot of their conversation is directly personally attacking Dr. Fauci. Then you have another 30% who are parents that are opposed to vaccines. So a lot of new individuals who are not part of the debate have jumped into it. And again, we don't know if they're really parents or not, but they're saying that that's their reason for concern. 10% are open conspiracy theorists. So most of what they say all day, every day are conspiracy theories. 10% are conservative activists. And then 10% are granola activists. So that's an interesting thing about this whole vaccine opposition movement is you really have individuals on both sides of the political spectrum who probably agree on nothing else in their life except for this topic. And then you have some smaller numbers. There's some elected officials who spread information, things like that. I know I'm coming up on time. I wanted to provide this to you. So much of this work is trying to look for signals. And so if you treat it like disease surveillance, there's a thing called Sentinel Surveillance. And that's where do I pay attention to the most, because it shows me a signal of what probably is true elsewhere. So these are the Facebook pages that we pay attention to the most. These are anti-vaccination Facebook pages. There's hundreds on Facebook, but these are the ones, if you're trying to just get a real quick temperature check, what's coming, this is where we look to. And then there's things like this what I probably would term questionable news site. And the reason I'm showing this is what we have found is as social media companies are getting better at playing this game of whack-a-mole, of shutting down content that isn't scientifically accurate, anti-vaxxers are getting better at circumventing that. And the manner of circumventing is they're going to accounts that are harder for social media companies to shut down. So private Facebook groups or well-known figures who for political reasons, it'd be very difficult to close their accounts, like Robert F. Kennedy Jr. So there's been this consolidation of around these different media channels in response to Twitter shutting down Twitter accounts, Facebook shutting down Facebook accounts. They're going to safe places, these islands. And they all, what's interesting about this movement is they're very coordinated. So when this occurs, there's a call to go here. They all actually do go there. And that's where they start getting their information. So that we wanted to share that with you because it is a changing landscape. And I'll end here. Right now, there's a Health Freedom Summit. These are the most famous anti-vaxxers in the world, as well as some new individuals. It's a like every conference these days, it's a Zoom conference. You sign up, but there's MDs, nurses, political figures, parents, and they're all sharing true or questionably true or outright false information. But the whole thing is it's openly about anti-vaccine vaccines, and it's how to do grassroots advocacy, how to get bills passed, how to spread information, how to start a Facebook page. So this is not something that's going away. It's something that's increasing and getting much more sophisticated. And I would argue, as have many other individuals, if you're looking at this from a public health perspective, we are woefully unprepared for the opposition to vaccines.